is Darwin Chimba. I'm the president of the Association of Future African Neurosurgeons and a final year medical student at Copperfield University School of Medicine in Zambia. We're happy today to have WordPress, a medical student from Cameroon, to take us through today's journal club. So it is really a great day that we're going to have again. I encourage you all to participate in this journal club. Obviously, it has to be quite interactive. So before we go into the presentation itself, I'm going to ask the panelists or everyone to introduce themselves. So I'm going to go on Dr. Ben. Please, you can introduce yourself.
Okay, good evening, everyone. My
Good
name
evening.
is Ben Ojakapeli. I'm a medical student from Moi University in Kenya. I'm happy to be here.
Thank you so much, Ben. We are happy to have you here as well. Then we have Musakanya. Please, you can introduce yourself.
Hi, everybody. My name is Musakanya Shpeka, a final year medical student from Zambia and also AFAN's country representative from Zambia. Thank you.
Thank you so much, Musakanya. Hope you enjoy. Then we have Olalwa Ezekiel. Ezekiel, you can please introduce yourself.
Greetings, everyone. I'm Olalo. I'm a second year medical student, third year medical student from the University of Ibadan, Nigeria. I'm happy to be here. Thank you.
Thank you so much, Ezekiel. We're happy to have you. Then we have Victory. Please, you can introduce yourself.
Good evening, everyone. I'm Victor Basifium. I'm a 500 level medical student from the University of Calabar, Nigeria, and I'm happy to be here.
Thank you, Victory. So we're going to go straight into the presentation, into the journal club. I'm going to ask the presenter to introduce himself and go ahead with the presentation.
Hello, everyone. Sorry for the interrupt. Okay, I'm a WAPRIS. Yeah, I'm a senior medical student from the University of Buea, Cameroon. It's a pleasure to be amongst your midst. So, am I ready to go with the presentation?
Yes, please, you can go ahead.
Okay, so once more, good evening, everyone. So today we'll be looking at the paper, the interplay between emotional regulation, emotional well-being, and cognitive function in brain tumor patients and their caregivers. So this is the outline of how we'll go through. So we'll look at the paper overview, then we'll review each section from the introduction to the abstract. Then we later look at the conclusion. So this paper is from SAZIV. SAZIV is an online preprint repository for psychological sciences. So on the paper, the type of study it's a longitudinal study. The paper was published in it was uploaded to the SAZIV preprint repository site in 2019. So we are going to review the paper using the Web of Science peer review academic guidelines. So to get started, we'll we'll go straight into it. So first we'll look at the introduction section. And the questions to ponder is it clear what is already known about the topic? Is the research question or aim clearly outlined? And is the research question justified given what is already known about the topic? So what I will do is, since we have the paper is quite long, so assuming we all read through the paper as it was pre-required, I will just give a brief recap of what was done in each section, of what the paper says in each section, so that we can discuss about it. I hope it's okay with everybody.
Yeah, I think that's fine. Oh,
Okay.
we can be going maybe paragraph by paragraph or something, but that's fine.
Okay. Yeah. So in the introduction to the section of this paper, the authors started by telling us how the brain tumor affects brain tumor patients. So they begin by saying that that cognitive function can decline as a result of a diagnosis of a brain tumor, as well as from subsequent treatment the patient is subjected to, be it surgery, radiotherapy, and chemotherapy. So, and they also go to say emotional distress decrease well-being in brain tumor patients. And there are studies that showed that 6 to 44% of the patients with brain tumor suffer from significant symptoms of depression, whereas 16 to 31% suffer from significant symptoms of anxiety. So the authors further go to tell us that physical and neurocognitive effect of brain tumor and their respective treatment can compress a patient's ability to maintain relationships, perform social roles, and stay engaged in valued social groups. So due to the severity of the disease, so most studies over the years focus now on how to improve the quality of life of patients and their emotional well-being of patients diagnosed with brain tumor. And one of such studies found a negative association between the use of planning as coping strategy and the patient's level of depression symptoms. So later on, Lazarus and Fogman made a first distinction between between problem-focused and emotion-focused coping. So later on, they went further to discuss about the cognitive, the different coping strategies, which consisted of cognitive reappraisal and expressive suppression. So over the years, they noticed that with respect to affective functioning, individuals who regularly use cognitive reappraisal were shown to experience and express more positive and less negative emotions. And they also displayed fewer depressive symptoms and reported a greater quality of life. Whereas individuals which who use expressive suppression as their coping strategies tend to display an opposite trend. And furthermore, they go further to say cognitive, that expressive suppression has been related to decreased memory. Okay, why cognitive reappraisal was not related to any NASIC performance. So it also goes further to tell us that in the domain of social functioning, studies have shown that individuals who habitually use cognitive reappraisal had better interpersonal relationship, whereas individuals who used expressive suppression report higher avoidance and less social relationships. So the paper for that goes to tell us that literature regarding the effect of that emotion, that's the paucity of data regarding emotion-focused coping strategies was less clear. So in order to justify the study, the authors had to investigate the influence of different emotion regulation strategies on emotional well-being and cognitive functioning of brain tumor patients and their caregivers also. So yes, and their caregivers, yeah. So the authors for that letter tells us at the last paragraph of the introduction, they tell us how they planned to go about their study. So they just give a brief description of the methodology there, which we will see later. So I hope I've been explicit in describing the introduction of the manuscript. So if anybody has any addition to what I said, you can come forward and stop. Okay, based on what we have seen so far. So is it clear what is already known about the topic? Is the research question or aims clearly outlined? Is the research question justified given what is already known about the topic? Okay, so in this section of the review, I will open the floor. I'll open the floor. Can I proceed?
Victor has, I think, has a question or something.
Okay, let me proceed. Yeah. So looking at it, yes, the introduction of this manuscript, it talks to, it explains to us what is already known about the topic. That's the effect of brain tumor on brain tumor patients. As we saw, they discussed about how cognitive function decline, how emotional distress decline. Sorry for the background noise. Unfortunately for me, this afternoon, there's some music playing somewhere in the quarter and it's affecting. So please just bear with me. So as I was saying, the authors highlighted what the previous studies found about the effects of brain tumor patients, how the studies over the year were trying to improve the quality of life and emotional well-being of brain tumor patients. Yeah. So so all that has been discussed, and they also discussed the various coping strategies that patients used by patients to deal with the neurocognitive effect they are subject to because of their condition. So yes. So is the research question or aim clearly outlined? Yes, I would say yes. The research question or aim is clearly outlined. In the introduction section, the authors let us know that there is paucity of data regarding emotion-focused coping strategies. So that's why when they had to do the study in order to look for the interplay between the different emotion regulation strategies on emotional well-being and cognitive functioning on brain tumor patients and their caregivers. Yeah, and what is also good about the introduction section is in every point that the author brought up that was referencing to a previous study, there were citations given. So here you can't identify any use of plagiarism. So everything was referenced. You can see as in the manuscript, there are references that are given, and all the references, many references were given to explain single points. So it was well, introduction section of this paper was well referenced. Yeah. So what is bad about the introduction section of this manuscript is that they did not define the specialized terminology that was used. For example, terms like cognitive reappraisal, expressive suppression, emotion focused coping, the coping strategies were not defined. At least to me, they had to make the reader understand what cognitive reappraisal means. They had to make the reader understand what emotional focused coping means. They had to make the reader understand what all of these terms means, but it's not really give a describing very well. So also in the introduction section, they kind of gave a discussion on the methodology. Yeah, they give a brief discussion about it, which to me is not really relevant in this part of the. There's a section allowed for it. They did not have to discuss it there. Okay, so yeah, if anybody has something to add, the floor is open.
Yeah, can I also just add something?
Yes, Darwin.
So remember, when you're looking at a paper, when you're writing a paper, obviously things like abstract, in fact, in some cases, even the title, those things actually come last. Okay. But in this case, you can see that when you look at the title, yes, it's okay. It's quite informative, but I think it's missing out certain information, especially because the title also has to answer things like the study. The study side. Where was it done? Okay. Quite all right. It has answered questions on what the topic is all about. Which is emotional regulation, emotional well-being, and cognitive functioning in brain tumor patients and their caregivers, right? But then, where was it done? So usually, you want to leave a title hanging like this if it's something that is not specific, maybe to one particular place or one particular site. But if it was done at a particular site, then it is always better. It is always preferred to include where it was done. If it was done, let's say in Ghana, if it was done in Nigeria, if it was done in Zambia, and so on, and probably if it was done at a particular hospital, a particular university, it's necessary to to include that. Why is it necessary? Remember, the title is it's more like the face. Okay, it's more like the face of your paper. Someone is just going to look at your title and they get interested to read about that particular title. Other people who particularly want to read something that is written about a particular place, a particular area, or from a particular country. So if you don't include that in your title, or at least somewhere, then it becomes a bit hard for people to actually even get your paper and get to read about it. Yeah. Then well, I think the other things you've pointed out, but the other thing that I would want to also mention is that it's just basically about the writing. So things like, for example, things like numbers. When you look at numbers, if a number is less than 10, then you would rather write it in words. But if a number is above 10, then you'd rather write it as in Arabic numerals, just as numbers. So I think those are some of the things that I would probably wanted to highlight. Otherwise, it's a good paper. It has given the overview, even the abstract. It has given quite some good overview about the entire paper, and then the introduction as well. As at least it has highlighted what is already known about the paper, like just like the presenter has mentioned, and all that. Yeah. And the research question, yes, it's clear.
Okay, Darwin. Yeah, thank you for the for your contribution. Yeah, actually.
Can I say something?
Yes, Pedro.
So the only issue I have with this is, apart from every other thing that you said, you and Darwin has said, the title is Interplay Between Emotion Regulation, Emotional Wellbeing, and Cognitive Functioning in Brain Tumor Patients and their caregivers. Now, what other neurocognitive effects of brain tumors do they have? They did not elaborate that. They just went directly to that. The readers are supposed to have like an idea of generally every other neurocognitive effects. I don't think only anxiety and depression should be enough for that. That's just the issue I have. They would have elaborated more on what other effects they have. In fact, all effects they have for that before narrowing it down to the emotional regulation, emotional well-being, and cognitive function. Thank you.
Yeah. Okay. Thank you. So, from what you're saying, the paper should have not only focused on the depression and anxiety, they would have labeled out other emotional well-being states, right?
Yes, they would have done that before narrowing it down in the introduction.
Okay. Yes.
Just to add on, or rather, it's like just to more like give some sort of a basis of the paper. You'd rather more like start it broadly. Okay, you look at the broad topic of it, more like the effects and all that of these brain tumors, isn't it? And then you narrow it down, like I said, you narrow it down to one or two aspects that you want to concentrate on. So you can mention a number of effects, a number of effects of these brain tumors. So like in this case, you can have the emotional and so on. But then you and others, okay, then you narrow it down to those particular topics, so that it's like the reader is being guided in that manner, so that you have a broader understanding, but then you start narrowing down to one particular aspect of the paper.
Okay. Yeah. Thank you for the contribution. So if nobody has anything to add, then we'll move to the next section of the manuscript, which is the methodology section. So the questions we'll ponder ourselves here is the study design appropriate to answer the aim? Are the study methods valid and reliable? Is there enough detail in order to replicate the study? If applicable, is the process of subject selection clear? Are the variables defined and measured appropriately? So, I will just give a quick recap of how the introduction section of the manuscript. So, sorry about the methodology. So here they discuss the participant and procedure. They discuss the measures in which they use to measure the emotion regulation, cognitive functioning, and emotional well-being. And they also discussed the statistical analysis. That's the statistical analysis they use to analyze the data. So first of all, the methodology, they start by telling us that the study was conducted in the from Ghent University Hospital in Belgium. Yes, and they said participants those selected were those who were scheduled for surgical removal of a glioma or meningioma, and the participants had to be above 18 years and able to complete a neuropsychological testing. So the study ran from May 2015 to October 2017. That's a 3 years span. No, 2 years span, sorry. So they managed to recruit 35 patients, of which 4 refrained from the study. 1 patient excluded because biopsy was done instead of a resection. Then 2 more patients were excluded because post-operative section biopsy revealed a grade 4 glioma. Yeah, okay. Earlier here in the participant selection, they said patients with highly aggressive brain tumor, that's meningioma grade 3 and glioma grade 4, were excluded from the study. So that's why 2 patients were excluded, because the post-operative resection biopsy revealed a grade 4 glioma. Okay, so that narrowed down their sample size to 28 patients, of which there were 11 patients with glioma and 17 patients with meningioma. So of this number, 11 primary caregivers also volunteered to participate in the study. So making a total number of 39 participants, right? Yeah, so several months now after tumor resection, follow-up data was collected now from 22 patients and 10 caregivers. That's 7 glioma patients and 15 meningioma patients. Okay. So in the next part of the methodology section, they went further to discuss how the measured emotion regulation and emotion regulation, functioning, and emotional well-being. So they said emotion regulation was used, that in order to measure emotion regulation, the emotion regulation questionnaire was used to measure cognitive reappraisal and expressive suppression. And the questionnaire consisted of 10 statements rated on a 7-point Likert scale. And they also the coping through emotion approach was used to measure the use of processing and expression strategies. That's for the emotional regulation strategies. Then for the cognitive functioning was assessed using the neuropsychological test automated, using the Cameroon neuropsychological test automated batching. And the 4 cognitive domains we are exploited here. That's sustained attention, working memory, information processing speed, and executive function. Yes, which then further to measure emotional well-being. That's the extent to which patient appeared to worry was measured using the Penn State Worry Questionnaire, in which participants had to rate 16 items on a scale of from 1 to 5. So furthermore, the state trait anxiety inventory was used to assess emotional distress on the day testing took place, and to assess the feeling of loneliness. The ocular loneliness scale was utilized. Yeah. So the authors also tells us that pre-operative measurement of emotional processing and expression was missing for the first 5 participants, as questionnaires were only added to the test batch later on. So they said that the authors tell us further that they did not discard these questionnaires from these 5 participants because this information was missing. They instead input the missing data under the assumption that it was missing completely at random. So the further goes to tell us the statistical analysis test which was used to analyze the data. And the authors told us that they use a linear regression model. That's the linear regression model was used to analyze the data alongside multivariate analysis of variance. Okay, so looking at the methodology section, is the study design appropriate to answer the aim? Are the study methods valid and reliable? Is there enough detail in order to replicate the study? Are the variables defined and measured appropriately? So please, the floor is open. Anybody can give his own point of view about the methodology section of the paper.
Okay, patients were eligible. Yeah, patients were eligible if they were scheduled for surgical removal of a glioma or meningioma tumor. So at that point, I was even thinking whether a glioma is the same thing as meningioma, which actually is not. So probably would have said that the patients were scheduled if they were eligible if they were scheduled for surgical removal of either a glioma or a meningioma tumor. You get, and this even brings them back to the point of not having a good topic, like the topic not being able to not narrowed down topic. Yeah. So that's just, it wasn't really that serious. Yeah. So if a reader is reading at that point, the reader might feel that a glioma is the same thing as a meningioma tumor, but where they now said the patients now said or the patients, number of patients for glioma and number of patients for meningioma, the person might be confused. So that's really what I had to say. Or that is what I saw at that point.
Okay. In my own opinion, to me, there's no problem saying patients were selected if they were scheduled for surgical removal of a glioma or meningioma. They are just telling us that any patient, what this statement means, that any patient who was scheduled for the surgical removal of a brain tumor was selected, be it meningioma or glioma. I don't know if I'm making some sense.
Okay, I would want to add something as well. I'm going to concentrate on this, the study design and of this paper, which is so they say they conducted a longitudinal study, right? So it was a longitudinal study that was done on these patients. So now, when you look at a longitudinal study, it's where you observe patients over a long, or rather participants of a particular study over a long period of time. It's really much similar to a cross-sectional study. But a cross-sectional study, you only get to observe, in this case, patients only at one point. So you want to see how particular variables and outcomes are correlating with each other. So in this case, so when you look at this particular study, this particular paper, I think it was okay for them to use a longitudinal study because they had to look at the difference between pre-op and post-op cognitive and emotional regulations of these patients. How were they emotionally and in terms of their cognitive functioning before the surgery, and how were they after the surgery? Were they worse before or were they worse after the surgery and all that? So unlike other studies such like the cross-section study, in that case you'd only have to look at in this same case, let's look at this same case, this same particular paper. You only concentrate on one point, at one point, just either before the operation or after the operation. You look at the emotional regulation before the operation, or you choose to look at their emotional regulation after the operation. But since you want to compare, is there any change? Okay, is there any change before and after the operation? So it is better to use a longitudinal kind of study, unlike a vertical kind of study, which is usually like in the case of the most cross-sectional studies, they are more vertical instead of longitudinal. So these types of studies, most of the times, they're going to be done over a long period of time. Let me give an example. Like if we look at members of the Association of Future African Neurosurgeons, let's say we want to look at their perception about neurosurgery, or maybe their interest in neurosurgery and all that. So you want to observe, or rather you want to see how these variables are changing over time, from the time before they joined Association of Future African Neurosurgeons, and then maybe a month after they joined, um, maybe 5 months or 6 months after joining, a year, 2 years, 3 years after joining. So you're going to find that others, their interest is going to start increasing the longer they stay in Association of East African Neurosurgeons, maybe because of various opportunities that they are encountering, maybe because of various activities that they're involved in, and so on and so forth. So you're going to find that their interest is going to start increasing. Then there are also those, maybe their interest is going to start decreasing. Their interest and perception and all that about neurosurgery is probably going to start decreasing, isn't it? Maybe because of the challenges that they now begin to foresee when it comes to doing neurosurgery, to pursuing neurosurgery and the neurosurgery practice itself. Because now it's like their eyes have now been opened, they're able to see more about neurosurgery. Okay, so in that case, you want to use this type of study, which is a longitudinal study, and you're going to observe participants over a long period of time. If it can even go up to 10 years or even 15 years, they're just observing these participants. So I just wanted to highlight on that study methodology, or rather that study design, and how it was quite applicable in this particular case.
Yeah, thank you, Darwin. Yeah, the study design was really quite applicable. They chose a good study design. Yeah, what I also love about the methodology section is that the process of subject selection is clear. It's quite clear. They discuss the inclusion and the exclusion criteria. Yeah, they also discuss every subject that was chosen was well accounted for in this methodology section. And they also explained, the authors also explained the different measures by which they will measure the different the emotional regulation, the cognitive functioning, and the emotional well-being. So overall, I think the methodology section of this manuscript was well sought out. Okay, without further ado, I think we have discussed the methodology section now. So we'll move now to the results section of the manuscript. And the questions we are going to be pondering is, are the results stated clear? Is the data presented in a clear and appropriate way? Okay, so let me go to the manuscript and then give a recap of the results section. Okay, so the results section of this manuscript is divided into parts: the descriptive analysis and the and also the explanation of the association between emotion regulation strategies, emotional well-being, and the cognitive function. Okay, in the first part of the results section, the authors start by telling us that this they were trying to checking whether the scores differs between the group, that's the meningioma, the Groma group, and the caregiver group. And in this section, the results displayed that the vast majority of the studied variables were comparable over time as well across groups. And in this section, they tell us that Groma patients reported to worry slightly more before surgery compared to meningioma patients. And they appear to use less expressive suppression after surgery compared to meningioma patients. Furthermore, they tell us that meningioma patients reported decreased usage of emotional processing after surgery compared to pre-surgical levels. They also tell us that state anxiety was significantly reduced. State anxiety was significantly reduced after surgery in all groups. Okay. So in the second part of the results section, they are trying to see tell us the association between the emotional regulation strategies, emotional well-being, and cognitive performance. And here they say before surgery, linear regression analysis showed no association between these variables. But in contrast, several relationships were found after tumor resection. Which been that expressive suppression and emotional expression were negatively associated with planning accuracy, as shown in that expressive suppression and emotional expression were negatively associated with planning accuracy. Furthermore, the extent to which patient reported to worry was negatively related to cognitive reappraisal, whereas a positive association was found with the emotional expression. So the product tells us that the amount of stress that state anxiety experienced after surgery was inversely related to the use of reappraisal. Okay, and they reference us to the to these graphs, which showed how suppression and expression was negatively related to the planning accuracy after surgery. I mean, that's the more the patient used suppression after surgery, the more the planning accuracy will be low. Same thing for expression after surgery, the more the patient uses, planning accuracy will be low. This graphs basically summarize all what was being they were trying to say up there. And the cognitive reappraisal after surgery, the relationship between that's the extent to which patients worry after surgery was negatively related to reappraisal after surgery. That's the more the patient uses cognitive reappraisal after surgery, the less, whereas in this second graph, the more the patient uses expression after surgery, the more the patient will worry. So yeah, state anxiety. This last graph tells us that patients who use cognitive reappraisal after surgery had a decreased state anxiety after surgery. So basically, yeah, that's all about the results section. So let's go back. Yeah, so these are linear regression graphs. So let's go back to the, are the results of this study stated clearly? Is the data presented in a clear and appropriate way? Yes, the floor is open.
Okay. Why? I thought the conclusion would have been after the conclusion would have been after study limitations. Because I don't understand why the conclusion will be up there and then there are other paragraphs that would have been before the conclusion.
You're right, Victory. I was also already confused about how the conclusion appeared here. So I don't know whether this conclusion was for the results, excuse me, where they're concluding the results, or I don't know. And when you look at because there's the heading for conclusion here, and then the conclusion section goes on and on and on, like the sort of having subsections, subheadings under conclusion, and after that, that's where you have clinical implications. Then after that, you have study limitations and acknowledgements and all that. So I can't see the discussion section. Of course, we've not yet reached the discussion section, but like there's no discussion section, then you have conclusion. I don't know if at all they have combined the results with the discussion, or maybe the discussion is under conclusion. I don't know. So
Yeah. So
I think
what
this is really confusing.
yes, actually, it's really confusing. So when reading through the paper, I noticed that in the conclusion section, they did the discussion. So the conclusion section, the discussion section is also on that. When you try to read through the conclusion, you see that they have done a lot of the discussion there, which is not normally supposed to be like that, I suppose. Even the results section, when you're reading through it, you kind of feel like a discussion of the results there. Anyway, it all being said, so to me, the results, however, are stated clearly here. We have everything is referenced to tables and figures. Though it didn't really focus so much on the statistical analysis to discuss it, because it will be above the scope of this presentation. So let's just focus on how they deliver their results. And looking at that, the results are clearly stated with tables and figures. Yes, you have to read through, you will see everything that is stated under the result, with reference to a table or a graph. Well done from the authors. Okay, we'll move forward now to the discussion and anyway, since I noticed that the discussion section was not presented as the standout point, I just combined it as the Web of Science Academy guidelines with them. So in this section are the results discussed from multiple angles and placed into context without being overinterpreted. Do the conclusions answer the aim of the study? Are the conclusions supported by the results? If not, are they supported by references? Are the limitations of the study fatal, or are they opportunities to inform future research? Okay, let's go to the discussion section, to the conclusion and discussion. So the discussion section, the conclusion section of this paper. So the authors go forward by telling us about the stability and consistency of emotional regulation styles, emotional well-being and cognitive function over time and across groups. And also we discuss the association between emotional regulation strategies and quality of life strengthened after surgery. Okay, when we look at it, we see that in this section, the authors they confirm the findings of previous studies, and they also highlighted what, what new their study brought to be what was already known in the discussion section. Yeah, and they also go to explain the different points, referencing themselves to the results. Yeah, I hope everybody saw it as I saw when reading this section of the paper.
Yes, I did.
Yeah, we're following.
Okay. So, and what's good there is that they also show that yes, they discuss the results while placing them into context. They reference themselves to, they compare their findings, the findings of previous studies, which was good, and they also brought forth their contribution to what was already known. Yes. So without further ado, yes, I think the conclusions answer the aims of the study, and the conclusions are supported by the results that we saw previously in the results section. Okay, conclusions of the study, yes. Though it came after the conclusion, the limitations, they discussed the limitations of the study, which were the fact that they had a small sample size, limiting, which limited the statistical power of their analysis. And the second limitation was the dependencies between patients and caregivers data. They are not really taken into account, since caregiver information of all the patients was not really available. So when the authors were discussing the limitations here, they also state what future studies should focus on, right? Yes, that, like for example, when they were discussing about the fact that their sample size was small, they said that they discussed the fact that as more efforts are being taken to make clinical data sets publicly available, yes, future studies will benefit from using larger sample sizes to investigate similar research patients in more homogeneous patients group. With regards to the second limitation, where they said patients and caregivers data were not available. So the authors here stated that future studies should consider including external sources of information, such as caregivers' evaluation, to obtain more reliable assessment of patient psychological function. So overall, I think the limitations here are well stated out, and advice for future studies also is also stated out. So yeah, this section of the manuscript well, just that it's not appearing where it was normally supposed to appear. So overall, though the format by which the displayed the conclusion, limitation section was not really that good, right? At least to my point of view, what they were trying to explain there, it didn't well. Right? I guess I'm not the only one thinking as so. Hey guys, who has other objections with regards to the discussion and conclusions?
I don't think I have any much problem, except what I already highlighted from the results section. Like the outline wasn't so clear, and some of the parts of these sections quite overlapping at all. Otherwise, other than that, I don't have any other objection.
Okay, yes, quite a lot. Yeah. So we'll move further to look at the references. So yes, what I like about this paper is everything they said here is reference. Like we have a lot of references. A lot of references we are used to explain any given point. So if it's with regards to the references, I think they did well here. Anything that was said that was referring to a previous study was reference. So my own opinion, the references are good, and the case studies pertaining to the title in question are present. Yeah. So the references are good. So having gone through the entire paper, the last thing now we'll talk about the title. Okay, we already talked about the title. Yes, we said the title was not informative a lot. Was it Darwin or yes, Darwin earlier said we get some critics the title area, yeah, which we are already justified. So now we'll look at the abstract of the manuscript. So having gone through all the manuscript, does the abstract really summarize what the results and conclusion are and the methodology used? Okay, let's check that. Okay, so looking at the abstract of this paper, personally, I'm not quite okay with the way they did it. Usually, okay, the abstract is divided into the objective, method, results, and conclusion. Usually, the abstract also contains the introduction. So, the abstract, we have the introduction, the aim or objective of the study, the method, the results, and the conclusion. So, what's lacking here is the introduction. Apart from that, I think the abstract is good. Apart from that, I think the abstract is good because the aims of the research are explained. They have given a brief summary of the methodology which is being used, and the key results we are stated without necessarily giving a brief explanation.
I still on the abstract. I think the objective where they say we examine the influence of different emotional regulation strategies on emotional well-being and cognitive functioning as indices of quality of life in patients and their caregivers in the early phase of treatment. Early phase of treatment, they did not tell us treatment of what. They told us that they handled brain tumor patients, that's patients with meningioma and glioma. That would have been included at least in the objective, in the aim. This is just so vague.
Actually, yeah, you're making a point. It's actually really big. Don't come to my attention, but now, yeah. Okay, with that all being said.
Okay, sorry, I wanted to add something concerning the abstract as well. Looking at the objective part of the abstract, it says brain patients may suffer from a range of health impairing problems, reducing their quality of life. To identify targets of interventions, we examined the influence of different emotion regulation strategies on emotional well-being and cognitive functioning as indices of quality of life in patients and their caregivers in the end. So for me, really, this does not look like an objective. It's like they're just describing what they did, because an objective is about what do you want to achieve after doing what you want to do, right? So like in this case, this is what they did. They have basically just described what they did, or rather what they did, but they have not really described what they wanted to find out after doing this. I don't know if you get my point. Besides, when you look at the first statement here, it's like they're now starting to give a background. Okay, so the fact that I've labeled objective, it changes everything. It changes everything. In some papers, if you've noticed, you find that the main objective, or which is more like they put it in terms of maybe some sort of a research question or something. It's usually the last sentence of the background part of the abstract, where you say, you give the background and then you state what you wanted to do. Okay, so I really feel it's more of what they just did than what they wanted to actually um, find out. Okay, then yeah, I think that's what I had to say about the objective, especially the first sentence there. It doesn't, it makes the whole section here not just be about the objective, but it's giving some sort of a background or something.
Yes, okay, Darwin. Yeah, thank you for the contribution. Sanya just got to us via the chat box. She said is that the objective was too long and not specific. Yes, quite all right. Just as Darwin was trying to, Darwin and Pichi have been trying to iterate. Yeah. So that being said, I think we have come to the end of this session. So as peer reviewers, this manuscript will not really accept it to be published. It has to undergo revision, multiple revisions. I think you all agree with me. Okay, I think I'm done with the presentation. So any contribution, if anyone has any contribution, the floor is open.
Thank you so much, Praise, for this presentation. We're grateful, we've learned a lot. I think just an highlight on future journal club presentations. We should encourage, especially the research fellows, those that have been enrolled into the research fellowship program, to make sure that they are always available for these journal clubs. So I think I'm sure Ezekiel is taking note of that. At least research fellows should be available. They should be either presenting or they should be attending. If you're not presenting, then you should be attending the journal club, so that you get to learn more about all these.